What do you do if you're in the middle of a case that was supposed to be fairly simple and straightforward and it becomes more complicated, and now the surgeon wants a Foley in, but you're in the middle of a case, and usually, at least the ones I've had to do it on, have been abdominal cases. The abdomen's open, the field's open, and you want to preserve your sterility. Let me preface this by saying, obviously, it's always best to have a Foley in first before the procedure starts, but sometimes you get stuck, so what can you do? So I'm going to run through what I do and do whatever you feel works for you. So you want to get the lap drape, you want to get the suction up toward the upper part of your field, you want to make sure the bovie's up and you have enough length on this that it's going to be enough to use for the rest of the procedure. Then you want to get a drape. This particular one is ideal because it has a sticky on it. If you don't have one that has sticky, like you would have to use a 3/4 or a half drape, 3/4 is better than a half drape, you would be able to clip it here, here, and here and get the same effect, because I think you'll see that I'm preserving the sterility pretty well by doing this. So you're going to take the sheet, and I'm going to have to play both parts, so you may not see everything lie down like it would normally. There's someone on either side of the table, so there would be two of us working on this. So you take the sticky off of it and you lay it down across, and you want to seal it down. Bring it down on either side. Person on the other side would bring it down. And then don't bring it down instead of bringing it down. This side's not all the way flat. I hope that one is. You bring it up over your sterile field, over the operative site. Now I'm going to have to switch roles, and I'm going to have to be the circulator. Then the circulator comes in and takes this unsterile part and rolls it up over the sheet that you've done. They frog leg the patient, who has some marvelous little Santa stockings on here for some reason, and obviously they'd have to push this up a little bit more, but for demonstration's sake this is good enough. They catheterize the patient, then they straighten their legs back down, and they put the seatbelt back on, and then the circulator will come and take this drape that was brought up from the bottom, bring it down. Now we're going to switch roles, and we're back to the sterile people. I'm sterile, and the person on the other side would be sterile. So you take the drape on either side and bring it down, and over the feet. And hopefully that's down that side like it would be if you had someone on that side draping it. And as you can see, we have preserved the sterile field and protected the operative site.